Hello everyone, I'm Dr. Mahesh Nair, founder of Nipentak Aesthetics, Cochin, and today I'm here to discuss the topic of facelift. Rhytidectomy, or popularly known as facelift, is a surgery where we can reduce the visible signs of aging from your face and neck. In this, basically, the skin and the soft tissues are lifted and redraped on your face so that your face and neck look much younger than what they are. Different types of facelifts exist. So we have something like max lift, short scar facelift, classical facelift, deep plane facelift, then even liquid facelift, which has just come into the market, I would say. And in liquid facelift, we basically use non-surgical modalities like fillers or Botox to enhance, volumize, and make your face look younger. So who is a candidate for facelift? I get this asked very often, whether my age is appropriate for a facelift or am I a good candidate. So let me elaborate on that a little bit. Age-wise, you can go in for a facelift anytime you start to feel, that you're looking really old. Something like from around 45 onwards, you can definitely start off. And there's no upper age limit for a facelift anyway. Candidature wise, it is like, when you start noticing that your face is sagging, your skin looks old, haggard, you get these deep nasolabial folds or cheek folds, what we call, the under eyes become hollow, you get jowls or pre-jowls, your angles of mouth start drooping, and you overall look haggard for your chronological age. That is when some people come and tell you're looking older for your age. That may be a right time when you can consider a facelift or a neck lift. Coming to the things what a facelift can't do, that also needs to be emphasized. Like, we cannot change the way you look. We cannot change entirely your identity or something like what they show in the movies, of course. And there are certain prerequisites that we like to emphasize upon before a facelift, such as stopping your blood thinners, stopping smoking, alcohol. These can influence the result of a facelift after the surgery. Hence, we request you to, stop these things before the surgery. So coming to the procedure of facelift or the technicality behind it, a facelift basically addresses the skin as well as the soft tissues of your face. We cannot change the bony structure or the skeleton of the face primarily, but the skin and the soft tissue can definitely be redraped. What I mean by that is the skin is lifted and the excess skin is removed, as well as the soft tissue, that is the musculature of the face which moves, with which you smile or maybe you cry, you frown. All these muscles form a soft tissue layer, and this also is redraped and repositioned to make your face look younger once again. So whatever the method that is involved, the basic end result should be that you get a natural looking facelift. You shouldn't have a wind blown appearance. Now, you must have heard of many facelifts like classical, deep plane, smash. The word smash must have come several times in between. That is basically your muscle layer of the face, which we, redrape over your face. So there are various ways of doing it. The classical facelift, what we usually do also, has a longer incision which goes in front of your ear and may go behind your ear also if you have a neck lift involved with it. The short scar facelift has a smaller scar, wherein the scar is hidden right over here in front of your ears. There's another variant to this called the max lift, and which has even a smaller scar. So there's a wide range of these facelifts which we are able to tell once we analyze your face and then give you options as to which surgery would suit you the best. The concept of a mini facelift over here, which I would like to elucidate upon, is basically involving a tightening of the lower face and a little bit of the mid face. Like, there are some individuals who come and say that, doctor, only my lower face looks a little old or my neck is sagging. What should I do? Do I need a facelift? Well, in cases like that, you don't need a full facelift, you need a mini facelift. So in that, what we do is we tighten the neck muscles, as well as the lower face is contoured. Numerous procedures can be added to this, like a chin liposuction, buccal fat removal, facial fat grafting, a lower lid blepharoplasty, along with this mini facelift, so that your whole face looks rejuvenated. So depending upon the type of the facelift that you have undergone, it can be either a daycare surgery or you may need an overnight stay at the max. And the recovery phase for a facelift surgery can last anywhere between 2 weeks to 4 weeks. There will be swelling and bruising. I'm not saying there may be, there will be for sure, because it's your face and that has been operated upon to give you that long lasting result. Again, I'm asked, how long is this result gonna last, doctor? So I would confidently say that a facelift result on an average lasts about 8 to 10 years. But it also depends upon what you are doing to maintain it, in which your diet, lifestyle, exercise habits, smoking habits, all of these things come into play.
Doctor, can a 50-year-old woman become a 20-year-old girl in terms of
I would say that's a little unrealistic expectation. One of the most important things in any facial aesthetic surgery, like a facelift, is to realize that there are certain limitations in these surgeries. We can reverse the clock or make you look a few years younger. That's why we ask from you your photographs of say 7 to 8 years or maybe 10 years younger, how you looked, and according to that we design your result. You definitely can't look 20, but I can assure you, you would look 40.
Oh, thank you.
Most welcome. So if you have any such queries or questions which you may feel they are quite silly or whatever it is, feel free to ask us, and who knows, we may be able to give you answers which could really surprise you, and you may feel yourself to be a candidate for a facelift. So do write in the comment section below and get in touch with us, and we'll be more than happy to help you out. Thank you.